Welcome back to my YouTube channel, everyone. Kyyah, aka Kyyah Savage, back with another video. My Canon is having technical difficulties, so I had to film the intro of this video with my phone. My SD card was formatted, which is probably every creator's nightmare. But today I have a very, very special interview with Nurse Mo, the resilient nurse. Having a conversation with her for the short moment that we did was very inspirational to me, and I hope it's inspirational to all of you. So let's get right into it. So the first question I wanted to ask you was, where did you go to college?
I went to school at Hampton University in Virginia.
Okay, and then obviously you got your bachelor's in nursing.
Yes.
Obviously. And where are you from?
I'm from Philadelphia originally.
So how did you end up in Virginia?
Okay, so when I was growing up, I didn't have the best experience. Growing up in Philadelphia is not the most welcoming, loving environment all the time. So I just wanted to go somewhere where people looked like me and they were brown, and that they were being excellent. Yeah. Because for me, it was like I didn't see anybody in my environment that I could relate to as far as like my goals. So when I visited Hampton University, I knew I wanted to go to a HBCU. Like that was my thing. I was like, I want to go to HBCU. Yeah. And so I went on an HBCU tour. Okay. And Howard, to me, like, I didn't like the idea that it had a open campus. I didn't love that. Okay. I didn't like that it was in the middle of busy DC. Clark didn't have my major. Neither did Spelman. Okay. And it was kind of far from me. And I went to Hampton and I was like, this is my vibe. These are my people. I went to visit. And like, I was like, I don't know how I'm going to afford this school, but I go here now. Yeah. During high school day back in 2005. Okay.
Yeah. I grew up in a predominantly non-diverse community, I'll say. Okay. So for most part, like, you know, middle school, high school, I was the only person of color. So it was really hard to kind of like self-identify and figure out where I wanted to be. So I knew when I was 18, I was like, I gotta get out of LA. I gotta get out of this place. So I ended up going into college in New Haven, and best experience of my life. So I can totally relate to you there. What made you decide that you wanted to be a nurse?
Okay, funny story.
Okay.
And I actually talk about this in a lot of my speeches when I travel all over and talk about nursing, is that I knew that I never thought nursing was going to be like an ultimate calling for me. I never even thought that it would be like a career. For me, it was kind of like a backup plan. You have my school was $33,000 a year to go to. Wow. And I come from a underprivileged environment. So I wanted to know that when I was taking out these student loans, that I was going to be able to have a job that would keep me gainfully employed for the rest of my life. Right. So I chose nursing more so by default because I wanted something that was sustainable and that I would be able to actually get employed. I didn't mind really hard work. I always had a job from the time I was 13 to now. And I was always willing to work really, really hard. And I loved people. I loved connecting with people. And my dad had diabetes when I was a kid, and I would check the sugar. Right. And he would explain to me carbohydrates and all these different things. And I thought that science was really cool. So I felt like, okay, maybe I can do this.
Yeah. So there are a lot of people who go into like medicine and nursing solely for the money. Now that you're in nursing and you're actually pursuing it, and now you feel that it's your calling, what advice would you give millennials who are doing it solely for the money?
So I think that nursing has a lot of great points, but I think that, and it's a really great job, but it's a great career, Right. But it's not easy. It has its moments where it is really, really gross. And people can be really, really mean. Right. And I don't think it has to be some divine calling for you. Right. But you do have to like the work you do in order to go. And it's not like a typical customer service job where you can have a little bit of an attitude and people let it go. Because you're dealing with people when they're at their weakest points in their lives. So you want to make sure that you're bringing good energy into that situation. And I don't think by any means that it has to be your calling or what you want your end all tell all to be at all. But you have to like it.
Right. So what's your specialty?
So my specialty is ICU. Yeah, it is. So I work, actually right now I work ICU flow pool, which I go to about 7 different ICUs. Every day I call it Russian roulette. I never know what ICU I'm going to. I can go to neurosurgery. I can go to cardiac. I can go to CT, cardiothoracic ICU. I can go to liver transplant, any type of ICU I go.
Right.
I have about 6 years of experience in ICU now. And I absolutely love ICU. It's actually a lot easier because you're dealing with two people and you're looking at them as your baby and the whole person for them. Right. So all of their needs are completely reliant on you for those 12 hours. So I love ICU. My specialty is anything in critical, I wouldn't say anything in critical care. I would say more on the neurology side of critical care. Okay. So I've worked trauma, I've worked surgical ICU, but my favorite is neurosurgery patients.
There are some people that I've talked to, some young people who say they want to go into medicine or nursing or become a doctor, but they don't know how they'll be able to live with the responsibility of a patient dying or something of that nature. So how do you deal with that heavy of a burden?
Okay, so I do my best and I let God do the rest. That's my, I know that's my slogan, but sometimes, like, to be honest with you, especially as a critical care nurse, I get patients who come in that do not have a fighting chance. Because they're already coming in very, very ill. So I do my absolute best and I do everything that I can. And I do my work with integrity. I do my work with care and I do my work with pride. And that's all I can do. Right. And when I clock out, I clock out. So I clock out for the day. I don't discuss my patients with my family members. Right. I don't discuss one HIPAA violation. But other reason is that I just let it go. I really try to let it go at the end of my shift because, you don't need to take that with you.
Right. So what's one piece of advice that you would offer to millennials and people in like Generation Z? Because you're also an entrepreneur. And some people will say like, oh my God, it's impossible. Like, I'm just tired all the time. So what advice would you give them if they want to pursue being an entrepreneur, but also are interested in something else?
So for millennials, because I'm like on the cusp of millennials and I actually hire a lot of millennials to do work for me, things like that. And I get a little frustrated with y'all because I know you're a little younger than me. And I'm on the older side of millennials. I would say that now millennials a lot of millennials are thinking that the entrepreneur thing is a lot easier because social media portrays it that way, that we can just live these lives as digital nomads and we don't have to do any of the work behind it. To be honest with you, working as an entrepreneur has been one of the most challenging things I've ever done. I actually went back to work. I took 11 months off from work and I went back to work in February because I wanted to do something that I knew how to do. Right. And that's working on people's brains. That's crazy, but I get it, but I wanted to do something where I felt comfortable. But I would say, don't be afraid of hard work. Right. Don't be afraid to fail. Right. Because that's where growth comes, is from the failure. Preach. It's just learning to be, and it sounds so cliche because so many people say it, but learning to be comfortable, by being uncomfortable is a good thing to do, but just not accepting that, oh, my life is uncomfortable. No, you're building a comfortable life for yourself and that is uncomfortable. Right. Does that make sense?
I totally get it.
But I feel a lot of millennials are very important. We're in the age of now. We want things right away. Instagram. So I would say do the work and don't be afraid of putting in the grit and getting your hands dirty and learning how to do everything. Especially as an entrepreneur, you need to know how to do almost everything that your staff knows how to do. Exactly. Yeah.
I completely agree with you. And I think social media, I always say it's a double-edged sword because a lot of the times people believe, like you said, you're traveling, you're doing all these things, but they don't know the logistics of what it really takes to be an entrepreneur and own a business. So I think hearing from someone as yourself who is successful in your own right and established, it's inspiring to know that it's possible, but hard work is really still at the core.
It is.
Yeah. So with entrepreneurship, and you said that one thing that's really important that I think you said was you wanted to be able to do something right. So mentally, how do you handle being an entrepreneur?
How do I handle it?
Yeah.
I'm still learning. And that's what I'm going to tell you. I'm going to be very honest with you. I'm still a student and I'm still learning. Right. So I consider myself a student. Right. as I consider myself a entrepreneur in training. I'm not ready to. I am very much an entrepreneur per my taxes, but I'm still learning. I'm still talking to other business owners, particularly female business owners, to see how they handle things, particularly women of color. Right. And as an entrepreneur, you have to kind of figure out what works for you. Right. So for me, working, when I first started working from home, I was like, oh my God, I'm not getting anything done. I haven't done anything. But then I would realize I would be working almost 10 hours a day because I wouldn't be focused. I wouldn't be present with my friends and family. Right. I was constantly emailing, setting up meetings and things like that. And now what I do is on Monday, sit down and work for 5 hours from my laptop. And that's what I do. And I bring my laptop with me almost everywhere I go. Right. And when I have a place that I feel is peaceful, quiet, where I can check emails, whether it be a nail salon, a cafe, a hair shop, getting my tires changed, I sit and I work in those places because sometimes it's more luxurious, a really nice hotel room, a beach. I work in those places. So entrepreneurship is a little different because you kind of have to work sometimes when you're inspired instead of when you of when you think you should. Right. So we all think that everything's just going to melt away and we're going to have this peaceful cloud to work on. And sometimes it's not like that. Sometimes you may have to pull over your car, sit in a parking lot and type in your notes. So it's just knowing when to work and really working when you get inspired to work.
Right. So the last thing, I know you just got off.
But I thought when I first started, I was like, I should be working from 10 to 4 every day. But that wasn't the case. Some days I would work from 4 p.m. to 4 a.m. on something. It's just
like
finding a balance. Huh?
It's because we're programmed like that. We're programmed to think it's 8 hours and that's all you do. You go to your work, you clock in, you clock out. But it's true. Sometimes you wake up at midnight and you're like, oh my gosh, I had this idea, and you have to write it down and you have to nurture that idea the next day. So you never know when the inspiration will come. But that's totally right. I know you just got off of your shift, so I want to let you go. But I just want to ask you one more question that I like to end my interviews with, and that is, what is your why?
Ooh.
Everybody always gets that reaction when I ask.
Because my goals are bigger than me. People are counting on me that I don't even know. Family, friends are counting on me. And I have this innate thing in me that makes me get out of bed at 4 o'clock in the morning and work on things, or stay in my scrubs and want to do an interview, or, fly for 10 hours to speak and then fly back. It's because I have the ability to touch someone's life, even if that's not my intention all the time. But when I really work at it, I can do it well. So those girls who I speak to and they cry in the middle of my speech, and people are counting on me that I don't even know yet. So that's my why.
No, that's an amazing response, and it's true. A lot of people, you are inspirational. I'm serious. I just stumbled upon your Instagram and I was like, oh my gosh, awesome. She's doing big things.
Thank you. I'm trying to kind of narrow down and figure out my niche a little bit more. Because it's kind of like travel, beauty, entrepreneur, but I like a little bit of everything. And I've been getting a good response from it, but I don't consider myself an influencer at all. So I think I do influence people, but I don't like the term influencer because I feel like there's so many people out there that are influencing people, but we don't know what they're influencing people to do.
That's true.
So I like to consider myself, and I don't like to consider myself a brand. I like to consider myself a woman who has gifts to offer other women.
No, it's true. You do. And the influencing thing, I think a lot of people on social media who are influencers, they influence you to buy something, or they influence you to believe in this type of facade of what Instagram life is. They influence you to spend your savings to go on a trip when you actually shouldn't. But what you influence, at least from what I've seen, is you're empowering people. So it's different. Because empowerment and influence is two different things. Thank you so much for doing this. We'll talk soon.
Oh, no problem. Anytime.
Okay, bye.
Bye.